Hey everybody, it's Dr. Tiffany at Sioux Center Chiropractic, and we're in Sioux Center, Iowa, and I have Emma here with us today. She is actually our content creator for the office, and a couple weeks ago she had a fall, so she's been having a few appointments with us, and she's been undergoing care. But before we get to that, I wanted to just say if anybody has any questions about what I'm doing or why I'm doing it, feel free to comment, and I will address those in my next video. All right, Emma, so you came a few weeks ago. This is your fourth appointment, your fourth adjustment. And tell me a little bit about what happened and where you've been having pain.
So it's probably been about 4 to 5 weeks ago that the fall happened, but I was leaving the pumpkin patch with my family and I was holding my baby in a carrier on my chest. It was dark and I stepped down into a hole, rolled my ankle, fell forward, and I braced myself to protect my baby from falling on him. So I caught myself with my wrist, my left knee, rolled my right ankle, and I've just been having a lot of neck, upper back pain, I think just from the baby weight on my chest. I was catching him, and so I think a lot of tension just is holding in my neck and upper back from that.
So let's kind of just go through a couple of those areas. If you had to put a number on your upper back pain, where's that at?
I would say it's about a 1 right now. Definitely has decreased over the last couple of weeks.
Awesome. What about your wrists?
My wrist feels good.
Perfect. And what about your right ankle?
Pretty back to normal.
Pretty back to normal. Awesome. Perfect. So we're going to move her. I'm going to just have her go through her gross ranges of motion. So we're going to see if anything creates pulling or pain. And then I'm going to also motion palpate her, and we're going to figure out where she has some joint blockages. Still, even though the pain is way down, we're still interested in fixing function on Emma. So this doesn't pop back up in a few weeks and we're dealing with the same thing or the same pain. All right, go ahead and stand there, Emma, and I'm going to have you mirror me. So let's move that upper neck. So let's look all the way over one shoulder. Other side. Any pain with either of those?
No pain. It's a little tighter going to the right.
Little tightness. So go ahead and go to the right again. Where do you feel like you're getting stopped at?
Right down here.
Right on that right side. Okay, let's go ahead and put your chin all the way to your chest. Good, come up. Any pain or pulling?
Nope.
Good. Same thing to the ceiling.
Nope.
Good. All right, let's go ahead and touch your toes for me. Good, come on up. Any pain with that?
Nope.
Good. Let's rotate all the way over one side. Good. That way. Nothing? Perfect. Let's bring your arms up and fall as far back as you can go. Good, perfect.
Just maybe a little bit of tension here, but
A little bit of tension when you're going back.
Yep.
All right, let's go ahead and sit on the end here. So I'm going to do what's called motion palpation, and what I'm looking for is just areas of stiffness or blockage. She didn't have a lot of pain, but pain is always the first thing to go away in a chiropractor's office, which is a good thing. But I want to change the function. I want to make sure the joint is totally restored in all the areas that were blocked or not moving like they should. So I just felt all of the joints of her around her pelvis, her SI joint on the right. Just when I take it and I sink in a little bit, you feel that. Mm-hmm. There's just not the same amount of give at the end range of that joint, and it feels just a little bit blocked. So we're going to adjust that on her. And I'm going to move up into her lumbar spine. And I'm just adding extension. And right there, she can just feel it's not extending the way it should. And on her end, it's probably just going to feel tight or like a block.
Yeah.
All right, keep going. And her TL junction, same thing. Nice little block there. Some of this is the fall. Some of this is just she's a nursing mother of a under one, so she's holding a heavy baby a lot. Okay, go ahead and interlock your fingers. Let's go around your neck. Oh, same thing. So she just does not extend. Right when I get to that mid-thoracic spine, go ahead and drop your arms. Good. We're going to come back with your head. Good, back up. Good, right there too.
Mm-hmm.
Definitely decrease motion in that upper cervical. What you'll realize is the more of these videos of mine you'll watch, a lot of the areas of restriction are going to be at the transitional ranges or the transitional segment. So sacrum, right between the thoracic and lumbar, right between the cervical and thoracic, and then right between the skull and the cervical. And that's just where we're gonna find the most areas of blockage. And that's exactly what we found on Emma right there too. All right, you ready?
Mm-hmm.
All right, let's go ahead and go on your stomach, Emma. So I'm gonna come through and I'm just gonna feel these SI joints on her, because she was really blocked in the right SI joint and at her lumbosacral region right here. So we're just gonna add a little bit of muscle work in here. Is that tight or does that feel okay?
It's okay.
Good, perfect. All right, go ahead and lay on your left side, facing me on this way. And I'm gonna bring this to me. And it wasn't extending seated, and it's not extending while she's laying. So I'm gonna do the same thing. Where she's not moving, I'm gonna add that motion in. Perfect. Other side. I'm just feeling the same motions, but I'm using her leg to take her through this flexion extension pattern, or this nutation, counter nutation pattern of the sacrum. Good. Perfect. All right, let's go ahead and sit up, Emma. All right, on your back. So I'm going to do what's called anterior to posterior palpation. So I'm going to bring her up with me, and just like when she was seated, I'm just seeing how she extends over my hand. And anywhere she's not extending, I can immediately move into the adjustment. Perfect. And then she's having a lot of tension in her kind of upper trap area, lower neck. And that's that transition area between the cervical spine and the thoracic spine. And that's where, when she was going through her global ranges of motion, she had some pulling and stiffness too. So I'm going to find where she has motion. I'm going to move that joint that feels a little restricted to through whatever range of motion she does have. And then when I feel that joint blockage or stiffness, that's when I'm going to increase the motion or put my chiropractic adjustment through that plane of motion to restore it. Same thing. So she's in right lateral flexion, and then I start to take that lower cervical spine through a little bit of left lateral or left rotation, and it just doesn't want to go. So that's where I'm going to add that adjustment. And like I said when she was seated, I'm very rarely going to adjust areas between, like the middle of her cervical spine or the middle of her lumbar spine. If it's blocked and it seems like a massive restriction, obviously I'm going to adjust it, but that's very rarely the cause pain or the bigger problem. We're always going to try and go find that bigger problem, and it's usually at the transitional areas. So we're at C1 on the left, her first cervical vertebra. Good, I got you, don't help. Good. Good, and I always say moms like to help. Emma's a mom, she's really trying to help me. She wants this adjustment to work. So I'm just waiting for her to relax under my fingers. And when she relaxes, that's when I go. Perfect. All right, Emma. Come on up. Let's recheck those global ranges of motion and rotate that neck all the way over one shoulder. Good.
Good. Much
Feel a
better.
little
Right.
better?
Yep.
Perfect. And then you also have a little bit of pain with extension. So bring those arms up and fall as far back as you can go. Good. Perfect. All right, let's take care of those extremities. You can kind of scoot back for me. So is your right leg or your right ankle that we roll, right? So the cool thing about extremities is we have 2 of them, so I can compare really nicely side to side. And she's definitely got some stiffness in her, in her calcaneus on the right. So we're going to adjust that. Good, hold on. Perfect. Okay, same thing, we're going to flex that foot up. Good, relax, relax. All right, so what this is a speeder board. So this has a little bit of a built-in drop. So her ankle and her calcaneus were both not wanting to manually release for me. So what I'm gonna do is I'm gonna mobilize that. All right, so we're gonna go right in here. So the range of motion it was not moving in, we're going to go back and palpate. Oh, it's better. Good. All right, the next one. So I'm going to get a hold of this calcaneus. So I'm going to have you turn this way, Emma. Good. And I'm actually going to sit between your legs. So scoot back for me. Okay, bend this knee. Good. So same thing with any other drop. What we're doing is just mobilizing this joint. So the range of motion, it wasn't moving in. I'm going to put it in there, and then I'm going to add a little drop to it. All right, let's recheck that. And like I said, we've got 2 of these, so we're going to make sure it's moving. The injured side's moving. It's better. Just as good as the uninjured side. There too. That moved easier. Good, perfect. Okay, let's swing those legs around. And let me see your wrists. I'm gonna take that watch off for me. Full body adjustment. They both bugging or mostly right?
It was just the right.
Yeah. While I was there. All right, let's see. This is actually moving really good. Is this bothering you?
Mm-mm.
Good. So her right wrist, which is the wrist she moved on, or she fell on, is actually moving and gliding really well. I don't feel any blockage. I don't feel any restrictions that I need to adjust. She actually had a little bit of tightness on the left side. Was that bugging or no? So she didn't really need this right wrist adjusted, and she's not having complaints, so we're not going to adjust it. We're going to leave it alone. All right, how's it feel?
Good.
Good. Perfect.
Awesome.
Thanks for watching.